Sandhya, over to you.
Yes, sir. We welcome you all for today's webinar, The Expert Guidance to Prevent Dry Eyes and Eye-Related Issues. Educational institutions continue to remain shut due to COVID-19 pandemic. Students spend long hours on computers and smartphones to attend online classes. COVID-19 pandemic is beginning to bother the student community as well as their parents with complaints of headache, eye problems, stress, etc. are surfacing out. Time spent on screen, not only for studies, even for other activities, is increasing, and thus this leads to eye strain. Today, we have with us Dr. S.T. Vijay Shankar to give us the awareness about how to take care of our eyes and eye-related problems. We welcome you, Doctor. Also, we welcome Ms. Sheila, Director, Headache Solutions, and her team. We welcome you, ma'am. Now, let me invite my friend Indumati to introduce the speaker, Dr. S.T. Vijay Shankar.
Good morning, everyone. Dr. Vijay Shankar completed his M.B.B.S from Kasturba Medical College, Mangalore, and his M.S. Ophthalmology from Sri Ramachandra Medical College, Chennai. He stood first in the M.S. examinations, securing the gold medal. Dr. Vijay Shankar did fellowship in cataract surgery and fellowship in glaucoma from the prestigious Sankara Eye Hospital, Coimbatore. Presently, he is Senior Consultant Ophthalmologist at Sankara Eye Hospital, Coimbatore from 2001 till date. Dr. Vijay Shankar has performed more than 50,000 cataract surgeries, SICS and Phacoemulsification, and has presented numerous scientific presentations in national and international conferences. Now, I would like to hand over the session to Dr. Vijay Shankar. Please, sir.
Yeah, thank you one and all. That was a very sweet introduction for me. At this outset, I would like to thank Dr. Narayanan sir, who took all the personal interest in going through forward with this meeting. Sheila madam also, who coordinated between the DJ Academy of Managerial Excellence and us to make this possible. And it's been an honorable moment for me addressing all you people. I'll put the slide share and then I'll start. Yes, all of you can see my screen share?
Yes, sir.
Yes, doctor.
Yes, sir. Okay. Now, it's basically when people approach me about the dry eyes, the whole talk is going to be on dry eye. And before I start with my slideshow or presentation, I would like to take a couple of minutes to explain what dry eye is all about. Now, our eyes should always be wet. It should never be dry. And when we blink the eye, when we close our eye, a layer of tear film covers the outer portion of the eye, that is the cornea, which I'll explain later, and keep our eyes wet. And when our eyes are open, slowly because of the atmospheric air, the eyes become dry. Then again, we blink, our eyes become wet. Then again, it becomes dried up. And this process goes on and on and on, like how our heartbeat goes on. Now, there are certain problems which is happening more frequently nowadays, which keeps our eyes dry. And I'm going to explain how to prevent those problems and how to take care of those problems to prevent dry eye. Now, this is the, of course, all photos, all contents in this slides I am taken from Google for study purpose only. Eyes helps us to see the world around us. This is the side view of the eye. The outer portion of the eye is called cornea. The inner portion is called, going inside, is called iris, pupil, and the lens, which helps us to see the world around us. The cornea is the outer portion of the eye. It is transparent like our watch glass and helps us to focus the rays in between, and it performs 70% of the focus and protects the eyes from the outside. Then comes the iris, which gives the shape and color to the eye. Usually, Indians, Asians have a brown color iris, but some people like Aishwarya Rai has blue color eyes. That is because the iris is blue in color. And there's a small hole in between the iris, it's called the pupil. And behind the pupil, there is a lens, which it's a convex lens, biconvex lens, which helps us to focus whatever we see with maximum clarity. Now, this tear film, that is the main part of the subject. This tear film is layer of a small thin layer of film, which is outside the corneal focus. This tear film has a lot of layers, a mucin layer, an aqueous layer, and a lipid layer. And this tear film helps us in stabilizing the focus of vision. So the functions of tear film, importance of tear film, healthy tear film is important for optimal vision and clear focus of vision. It provides 80% of the refractive power along the anterior surface of the cornea. The lipid layer gives lubrication. That's why we feel comfortable. If the lipid layer is less, we feel irritation, redness, and all those things. The mucin layer reduces the force during the blink, and the tear film protects it. When we travel, when we go out on the road, a lot of small dust, small foreign bodies do certainly fall into our eye. And this tear film increases the quantity when something falls into the eye and pushes all the small foreign bodies out of the eye. And it also gives nourishment to the cornea. Now, where does the tear secreted from? If you see in this diagram, the outer upper portion of the eye, there is a gland called lacrimal gland. This is where about 90% of the tears are secreted. And it comes into the eye. And it keeps the eye wet. And the excessive tears are pushed out of the eye by something called a nasolacrimal duct that is near the nose. And the excessive tears goes into the nose and into the throat, and it gets absorbed faster. Now, there should always be a balance between the amount of tears which come into the eye and the amount of tears which go out of the eye. If a lot of tears go out and less tears come into the eye, it will cause a dry eye. Yeah. Dry eye is a condition where we either do not produce enough tears, or the amount of tears which is produced is of a poor quality. As I had mentioned in the slide before, the tear should have various layers, an aqueous layer, mucin layer. All these layers should be adequate in nature. Otherwise, if there is no balance between the layers, then we get dry.
Doctor?
Yes, sir. Yes, madam.
Sorry to intervene, doctor. Still, it is breaking. The voice is not quite
my
clear.
My voice is breaking. Oh, I have pushed my mobile a little bit near me. Is this okay?
Yeah. Now it's much better. Thank you, doctor.
Is there any problem, please? You can feel free to interrupt.
That is why I intervened, doctor, because it is very important. Okay.
Yes,
we don't want to miss out anything. That's why I called you.
Absolutely.
Please go ahead. Yeah.
Yes. So what causes the dry eye? There are a lot of causes for a dry eye. The most common is the age. Everybody above the age of 60 to 65, their tear secretion will not be as good as how it was when they were in their 30s and 20s and 30s. Gender, and sorry to say, women are more common to develop a dry eye than in men. And medication, before medication, certain diseases like diabetes, hypertension, cholesterol, knee problem, rheumatoid arthritis, knee problems, knee pains, all these diseases are associated with the dry eye. And medications such as antihistamines. Antihistamines are the ones which we commonly take for cold, cough, and fever. Increased blood pressure, decongestants. all these medications, when you take, sometimes what happens is the doctor will give us medication for 5 days. But the tablets we take only 3-4 remaining, we'll keep it there. And after 3 months, we have a 2 sneezes, 2 coughs, we take the tablet to eat. All these things should be avoided. If we do that, we don't follow meticulously eating tablets whenever given by the doctor, this will cause dry eye. Certain medical conditions like rheumatoid arthritis, diabetes, as I had mentioned, certain environmental conditions like, a windy climate, person sitting in the AC for a long time, which I will elaborate further. And there are other causes like, person wearing contact lenses for about 8 to 10 hours a day, patient undergoing the surgery called LASIK eye surgery, which is becoming very, very, very common nowadays, can cause dry eye also. These are all, very rare causes, something like, Sjogren syndrome, poor nutrition. That's another most common cause of dry eye, especially in children, is lack of vitamin A. Lack of vitamin A is the most important cause of dry eye in children who are in the age group about, say, 8 to 10 years. For them, adequate sources of vitamin A and a balanced diet should be given. If that is not given, usually malnourished children end up having a dry eye, which is irreversible. And in children, the other causes are juvenile diabetes, systemic medications, environmental factors, etc. So now, if one person has a dry eye, what will they feel? They'll feel redness, they feel pain and irritation in their eye. They read for 10 minutes, 15 minutes, 20 minutes, they get tired. Their eyes get tired. They get a little bit of burning and irritable sensation, and they will not be able to wear their contact lenses, which they have been using before. And if ignored at this stage, these are all the redness, pain, and irritation are all early symptoms. If they are ignored, it will lead to episodes of blurring vision or a sandy or gritty feeling. Decrease the tolerance to screen time, that is the TV, seeing the mobile screen or a TV screen or whatever. They will generally try to close their eyes and sleep. They will not be able to concentrate either on their book or their monitor or their screen. And now, the most common cause now is computer vision syndrome. See, when I was doing my college, probably schooling and college, that was the time when only the computer professionals used the computer. No other people in other professions never used their computer. Then came to a stage when I was doing my post-graduation in early 2000. The lot of other people, that was the time when email was invented, and a lot more common men started using the computer. Then the stage came about, say, 5 years, probably about a year or two back, where everything went digital. Our even hospitals, my hospital, my medical records are digital. Your college records have become computerized, and if that has gone digital, everywhere, ticket reservation system, everywhere, everything has become digital. And now it's become a must for a common man to use computers. And the worst scenario is the last 1 year, where because of Corona, there is no school, no college, no work, everything completely dependent upon computer. And what can this cause to the eye is called computer vision syndrome. This is a digital eye strain. This does not only mean a computer, it also means looking at your TV for a long time, even if it's an India-Pakistan cricket match, looking at your mobile screen, looking at your tab screen for that matter, for a long time. It does not matter whether your screen is an LED or LCD or ELED, OLED, does not matter. Any type of electronic device which you focus into will cause this computer vision syndrome. and it will result in a chronic dry eye. So this is a small graph showing that the internet users are the maximum in Asia. Of course, it also is because of the population of India and China, the world's two most populous nations being in Asia. But still, the maximum internet users, the maximum people exposed to computers or digital screens are in Asia. What happens when you look at computer is that computer screens are all made up of small, tiny pixels of dot, which is hard to focus. The computer user should always keep focusing again and again on the screen to get a sharp image on their eye. And this results in lower blinking rate while using computer. Yes, as I had mentioned, the computer's vision syndrome does not only mean computer, it also means laptop, TV, smartphone, tablets, any electronic device for that matter. Now, symptoms of CVS again is in severe eye strain when used a long time. Focus will not be that very clear or that very sharp. Headache after long hours of use of computers, irritation in the eye, and of course, there are other problems. The last problem is not related to the eye, but they can have a back pain, shoulder pain, neck pain because they keep bending at the computer screen while using this. And this is the most important thing. Normally, an average person blinks about 12 to 16, average 14 times a minute. And as I said, every time you blink, a tear film covers the eye, it wets the eye, and when you keep your eyes open, it gets dried. So during computer use, during TV use, when something important is going on, even for that matter, when I'm doing my surgery, when I'm concentrating on during my surgery, we all forget to blink. We blink only 4 to 6 times per minute rather than 14 times a minute. This results in the less tears coming into the eye and results in dry eye. Now, another most important cause is sitting in an air-conditioned room. Air-conditioned rooms have less humidity when compared to the normal room. The tears evaporate very faster in an air-conditioned room compared to a normal room. So air-conditioned cars also, what we do is we focus the air condition of the car right in front of our eyes or in front of our face to get that chill feeling, but that should never be done. And frequent air travel, the humidity in an aircraft is kept about, say, 9 to 28% at 23 degrees. Whereas if you go out, the humidity is close to about, say, 90%. The 9 to 28%, roughly about 20% is quarter as that of the normal humidity which is there outside. Humidity, because of the less humidity, it increases the evaporation of tears, and frequent air travels do cause exacerbation of dry eye symptoms. Now, what do you get? What you should not ignore when you have a dry eye? If you have a dry eye, you will get eye infections very frequently, and you will damage the surface of your eye. That's the surface of the outer surface of the cornea, and the quality of eye and the quality of your life drastically drops down because of dry eye. And what are the most important thing? What do you do? What should you do rather to reduce the dry eye? This is a 10-step relief to get relief from computer eye strain or even a dry eye for that matter. One, take a comprehensive eye examination frequently. We suggest people who use computers, roughly about, say, 6 to 8 hour use of computer, should get their eyes tested every yearly. People who are above the age of 40 should get their eyes tested yearly. And anybody who's complaining of red eye, dry eye, dry eye symptom, irritation, all those things, we have a small test, a 5-minute test by which we can determine whether they have a dry eye or not. And 99% of the dry eye is treated with eye drops. No complicated surgery, no tablets, nothing is necessary. Plain application of eye drops, probably 3 times a day to 5 times a day is enough. So one need not be scared to go and tell a doctor, doctor, I have a dry eye. எனக்கு கண்ணு எரியுது, கண்ணுல தண்ணி வர மாட்டேங்குது. அப்படின்னு you need not get scared to go and tell a doctor that you have symptoms of dry eye, and the treatment is very simple. Now, especially when using the computers, especially when reading books, use proper light. Sit under, don't sit between the book and the light. The whole focus of the light should be on the book or on the electronic media, and adequate lighting is also very important. Some people sit between the book and the light so that their shadow of their head, their face falls on the book. Half the book will be illuminated, half the book will not be illuminated. That's wrong practice. You turn 90 degrees, keep the book between you and the light to focus properly and maintain good hygiene of your eye. Minimize glare, like, having a glass or having reflections all over in your computers there or when your books are there. Minimize all these glares. There are certain anti-glare glasses available. Even if you don't have any power, a zero-powered glass with anti-reflection coating or anti-glare coating can be available for people who use long hours of computers. Number 4, upgrade your display. LCD display, LED display can make things better when you compare to your old system. But even that's not a reason, that's not an excuse. Having an LED display is not an excuse for anybody to sit with the computer 12 hours a day. It's better than an old tube display, but take a break in between. And adjust your computer settings. Very, very important. You have to, the best is black on white, the white screen and black font. For the sake of fancy, for the sake of whatnot, people do a lot of other things, get rid of all those things and have a simple black and white font with which you can read. Of course, a lot of mobiles now do come with, night read mode, which is definitely helpful and healthier to the eye than the older ones. You can use that. I'm not saying no. And blink more often. As I had mentioned earlier, we blink around 12 to 15 times a minute. That comes down to 4 to 5 times a minute when we use more of computers. So make an effort, voluntary effort to blink more. Blink roughly about at least 10 times a minute so that your eyes don't get tired and your eyes don't get dry. Exercise your eye. Take a break in between. Look at a far object. When you're using computers for 8 hours, 10 hours together, probably every 1 hour, probably every 1.5 hours, sit a break or 2-minute break, 3-minute break. Or coffee kudichittu, look at a distant object or keep your eyes closed. And another exercise, simple exercises, keep your eyes closed. Keep both palms on your eye. நம்மளோட கையை ரெண்டுத்தையும் கண்ணுல வச்சுட்டு just a little bit of pressure. கொஞ்சம் அமுத்துனனா that will increase the blood flow to the eye through the lids. That will give rest to the eye and that will keep your eyes healthier and relaxed for your next session of computer. And the most important thing, I tell all my patients, computer use பண்றவங்க every hour to hour and a half, take a 2-minute break, 3-minute break. That itself will give a rest to the eye. வேற எதுவுமே பண்ண வேண்டாம், படிக்கவே வேண்டாம், கண்ணை மூடிட்டு உட்கார்ந்துருந்தா போதும். 2 minutes, keep your eyes closed. that itself will give you a lot of relief in between long hours of computing. And of course, yes, you can definitely modify your workstation. Always, it does not come under my purview, but your height of the computer and height of the chair should be taken care. Illati back pain varum. The orthopedician actually should explain this. The height, the top level of the computer should be about a couple of inches below your eye. And you should sit erect, like how it is shown in this diagram. You should not bend over and see the computer. You should sit erect. These small modification in your sitting style, working style, your workstation will certainly help you in. And consider wearing computer eyewear. As I had mentioned, non-powered eyeglasses are available. Anti-glare eyeglasses are available, which will help you in your computer use. All these things I'm telling you for people who have to sit for long hours with computer for their work. Now, computer class போடுறேன், நான் break எடுக்கிறேன், நான் எல்லாம் பண்றேன், ஆனா 12 hours I sit with my mobile and play PUBG. That is absolutely wrong concept. PUBG, all these things can be avoided. Computer games, mobile games can be avoided till probably, Corona comes down and our normal day-to-day life gets back. So, certain tips to stimulate tear production are drink plenty of water, include sources of fatty acids in the diet, like fish oils, almonds, which are also rich in vitamin A, and eat a lot of fruits and vegetables. Again, fruits and vegetables are rich in vitamin A, and even the fruits and vegetables improve the liquid quantity which going into our body. Avoid eating a lot of meat, fats, and carbohydrates. So, in spite of all these things, when to contact an eye doctor? Of course, as I had mentioned, always better. Yearly once I check up people with complaints. Appadi illanalum, patients with red eye, painful eye, discharge in the eye, always irritation. When you have the feeling that to bring your hand, கண்ணை கைக்கு கொண்டு போகணும் அப்படிங்கிற ஒரு ஃபீலிங் இருந்தா, that means something is wrong. All normal people do not rub their eye at all. If you try to rub your eye, even once a day, twice a day, கண்ணுக்கு போகணும் அப்படிங்கிற ஃபீலிங் இருந்தா, that means something is wrong with your eye. You have to consider your eye doctor. Other things like joint pain, stiffness, early morning, கையை மடக்க முடியல, காலம், especially older people in 60 plus, கை டைட்டா இருக்கு, கை மடக்க முடியல, கால் மடக்க முடியல. They have joint pain, which is very, very closely associated with dry eye. Having a dry mouth also is associated with dry eye, and they should consult the medical profession. Summary, when enough quantity of tears are not produced, it causes dry eye. Due to this, the lubrication to the eye becomes bad. The nourishment to the eye becomes bad. So, computer vision syndrome now, as I have mentioned over the past 20 to 30 years, is the main cause for dry eye. And unless it is necessary for your work, avoid using your screen time. There are a lot of charts which have come up, starting from a 4-year-old, 5-year-old to a 60-year-old. What should be the on-screen time and off-screen time for everybody, every person, depending upon their age, depending upon their work? What should be the average on-screen time per day? Nariya charts. You can go through, Google them and go through them, and follow it strictly to avoid dry eye. And in case of severe problems, kindly contact your eye doctor. Thank you for all of you for giving me this opportunity, and I hope I have, within this time, I have done justice to, giving some knowledge to all of you in this time. Thank you.
Thank you, Doctor, for that very informative awareness. It's now open, Dr. Narayan, for your students and faculty to ask questions.
Yeah.
Can I begin with one question, Doctor?
Please, ma'am. Go ahead.
Doctor, just wanted to ask a question.
Yes, madam.
For prolonged screen time, must eye lubricants be used as a preventive, or must they be used only when there is a problem or discomfort in the eye?
Yes, the lubricating eye drops should be used only upon the prescription of an eye doctor, madam. For some people, it depends. We grade the severity of the dry eye. It starts from mild, moderate, and severe. Depending upon the severity of the dry eye, we give lubricating eye drops. For some people, very mild dry eye, even as I had mentioned, without any eye drops, normal exercise and rest and avoiding on-screen time would itself work. So use lubricating eye drops only upon the prescription of the doctor, and please do not self-lubricate yourself.
Thank you, Doctor.
Okay. Students, now it's open to you.
Students, you all have access. You can unmute and ask your questions.
Good evening, Doctor. This is Captain Senthil here, Chief Executive of JKT Trust. First of all, thank you for attending this session and enlightening our students about the dry eyes issue. I have a question, Doctor. In fact, I'm 45 years old, okay, but I started having developed this cataract issue during the pandemic. And in fact, I got one of the eyes done the cataract surgery also. So probably the reason they said is probably I might have, because I asked generally cataract issue is above 50, 55, you know. So the doctor said maybe I was too much, well, in army, I might have been exposed to the bright snow light, or maybe that could be a reason also, he said. Or last 10 years, I am in corporate world using extensive, you know, the laptops and computer screens. So, and then another thing doctor said is like, even nowadays, youngsters at 25, 30 also are getting cataract, you know.
Yes.
So what is the reason, doctor? Why it's such a young age? Because earlier we always had, elderly people only used to have cataract issue.
Yes, sir. Okay. No, deviating from the topic, but it's a good question. It will be informative for others also. Cataract usually is more common above the age of 60. So why does cataract occur? Is because of the exposure to UV light. So it is more common in people like, who are in agriculture, who are exposed to sunlight and who have a lot of UV rays. And nowadays, a lot of computer professionals who have a lot of UV rays in their computer monitors, mobiles, tablets, electronic media also do get cataract at an early age. Early age in the sense not 20s and 30s, like you said, for early, late 40s or early 50s. That is one most important thing. Exposure to UV light because of your use of electronic media. And probably it is genetic also, sir. I don't know. We cannot completely come to a conclusion that this is why you got this cataract. Probably an aggregate of multiple factors made you have this cataract at slightly an early age than the others. But of course, with the latest facility available for cataract surgery, I'm sure 100% of your vision would have been restored after cataract surgery. Isn't it, sir?
Absolutely, doctor. Yes, that is after the surgery is so much of comfort, and thank you, doctor. Thanks for the question.
Doctor, one more question.
Yes, ma'am.
Is it true that screen time during night disturbs the sleep pattern?
Sir, I didn't get your question. Your voice is very low. Can you?
Doctor, yeah. Am I audible now?
Yes, you are audible. Please go ahead, madam.
Yeah. Doctor, is it true that screen time during night affects the sleep pattern?
Yes, of course, yes, madam. Yes, I forgot to elucidate that one. Good that you asked this question. Lots of us, including, I don't want to name, but lots of us have this habit of switching off all the lights in the room and, playing, sometimes even official work before we go to sleep, or playing with the mobile or checking messages, or even for that matter, some people get up in the night, 2 o'clock. Probably to use the washroom. This will affect our sleep pattern. Our sleep pattern, again.
Doctor, your voice is breaking, doctor.
Slight deviation from the topic. We have two types of non-REM eye movements. Yeah. Now, madam?
Yeah, we can hear you
Is
now.
it okay?
Doctor.
Yeah.
Yes.
We have two types of sleep, REM sleep and non-REM sleep. This REM stands for rapid eye movement. Our eye moves rapidly during our sleep. This REM sleep is very, very important for us to feel fresh the next morning. If we do not have this REM sleep, if you have a disturbed sleep, if you do not have adequate REM sleep, you'll get slightly, dizzy the next morning, lack of sleep, we feel sleepy at the class, etc., etc. So for this, you have to switch off all your electronic devices at least an hour before you go to sleep. Definitely, it's very important.
Thank you, doctor.
Doctor, I do have a question. Doctor, this is with reference to the choice of the device the students use for learning. If I'm right, invariably, even NODA students say, I think more than 90% of the students, they may be using their mobile rather than a PC or a laptop kind of. So does it have a bearing on these kind of issues, doctor?
More than the device itself as such, there are two factors which come into play, sir. One, the distance between your eye and the device.
Yeah.
When you have a mobile, it is about, say, half a feet.
Yeah.
When you have a laptop or a desktop, it's about, say, 1.5 feet.
Exactly.
That is much better than having a mobile.
Okay.
Two is the size of the image. No, I'm talking about an LCD or an LED screen of a desktop, not the curve like older times.
Yeah.
Two is the size of the image.
Okay.
In a mobile, it's much smaller than when compared to what do you call a tablet, or even for that matter a desktop screen. Of course, yes, it can be managed, but the more important fact is the distance between your eye and the electronic device. So it's always better to have for a long hours of viewing, always better to have a desktop or a laptop rather than a mobile. Sir.
Okay. Right. Students, do you have any questions?
Doctor, I have a question.
Yes.
Usually when we have a headache, we go and ask for a crocin. But nowadays, Tear Plus and Refresh Tears are sold over the counter like hotcakes. So it's safe. So what do you?
The answer of mine will be the same as the answer of my first question from Madam. Kindly avoid even paracetamol or crocin or a Tears Plus or any lubricating eye drops. Avoid buying over the counter. And as I had mentioned in my slides, the tear film has 3 layers. Lipid layer, you have tear film deficiency, some people have aqueous deficiency. Who fits into which eye drops has to be decided by the eye doctor. There are various types of lubricants available, lubricating eye drops available. Which would be best for that person should be decided after the number of tests, 3-4 tests, putting them across number of tests. So kindly avoid buying over-the-counter prescription of eye drops. Even for that matter, if I would have probably given a prescription for a dry eye for a patient today, don't keep the drops. After 2 years to put the same drops, or after 2 years, take the drops, go to a pharmacy, buy a new drops over the counter. And please avoid all these things. It will only complicate matters if the incorrect drops are used.
Okay. The reason I asked was I had this problem for my daughter after she started his online. So my dad gave this prescription. When I went to this Pasume pharmacy, it was out of stock. They told
No, see, probably the pharmacist in an eye hospital would be aware of the various kinds of eye drops and the different usages of it. But I doubt whether a pharmacist at the pharmacy level, Adaga pharmacy or health, I'm not naming again, but that level would be aware of the contents of the various types of lubricants and which would suit better and which is the best alternate, that those pharmacists might not be aware. So it's always better to go back to your doctor and ask for a replacement rather than asking at the pharmacy level.
Thank you, doctor. Karthik, you are not audible, Karthik. Your voice is breaking.
Good evening, sir. Now it's audible.
Yeah, it is better.
Yes, sir. Please go ahead.
Sir, is there any natural lubricant?
Natural lubricant is our own tears. If that's why I said, a small test, a 5-minute test, is enough to measure how good your natural lubrication is. And if your natural lubrication is good enough, all you need to do is take small breaks every 1.5 hours, take all these preventive measures by which you can avoid a dry eye and not take any artificial lubricants for that. It's a small test, a 5-minute test. There's a small, all you people should know a filter paper. There is something called a Whatman number 41 filter paper, which is a specialized filter paper. You will keep it in your eye, in the corners of your eye. There will be marking between 0 to 35 in that filter paper. Normally, for everybody, the filter paper should get wet till 30. It's not 30, then it indicates a dry eye. But if it wets till 35 and still you have certain symptoms of dry eye, then all you need to do is precautionary measures. That's all. Natural lubricant is a natural lubricant. There is no second question about it. Take precautions. That's more important. Prevention is better than cure.
Sir, another one question, sir.
Yes, please.
You have said it is about blinking of the preventing measures.
Your voice is getting broken, sir, please.
Sir, you said blinking of eyes.
Yes, frequent blinking of eye do take care of eyes not becoming dry.
Sir, whether it will recover our damage or it will prevent us from further damage?
No, see, at times, if the damage is early, very early, yes, it might prevent, but it is basically all these measures I took, mostly explained in the past half an hour to 45 minutes, are all preventive measures from you people, not especially people with long hours of computer use, not developing a dry eye. And if you have symptoms, I said it has to be evaluated and we will advise accordingly. whether the patient needs any medication or frequent blinking, taking hourly break. All these measures will help their ear function or not. We will evaluate it, we will tell you. It will depend from person to person. A single thumb rule is not, cannot be used for everybody else.
So any more questions?
Any other questions? I think they are quite clear with all your prescriptions, doctor.
Yoga, yes, I am not against yoga or alternative medicines like homeopathy or Siddha or anything else. But I don't know. You should ask a yoga practitioner how it is the trial.
Okay.
But I'm not against it. I can reassure you that.
Yeah.
There are a lot of things. A lot of my patients also do that. Couple of people go for reflexopathy. They've been asked to stand or wear rubber slippers with small acupuncture-like thing. Reflexology, that's the correct reflexology treatment for their dry eye and their joint pains. They come back with considerably good results. But as I said, I don't. I'll stop now. I will not then, but I will say I do.
Okay. Shiraman, can we wrap it up if there is no other question?
So can I say a few words to thank
Please,
you?
ma'am. Yeah.
So, on behalf of DT Academy Coimbatore, we from Educate Solutions thank you, Dr. Vijay Shankar, for a wonderful presentation and for taking time out from your busy schedule to spread awareness to the participants today on this very important topic. Thank you, Doctor, for providing us with insightful tips on how to protect our eyes and also for patiently answering all the queries that were raised. Thank you, Dr. Narayanan, for giving us this opportunity, and Professor Sriraman for seamlessly coordinating this session. Thanks to Mr. Balasundaram from Elegant for connecting us with the doctor. Thank you so much.
Thank you very much, ma'am. Sriraman,
I would like to take this opportunity again to thank all of you, especially Balasundaram from Allergan, again, Narayanan sir, Sheila madam, all of you to make this wonderful 1 hour happen, and let this ties of us continue further. Let it not stop with this 1 hour and let it continue further ahead.
Definitely, doctor. Just a minute. My student is proposing the vote of thanks formally.
Yes, sir. So Hemchand, I would now call upon Hemchand to propose the vote of thanks. Indeed, wonderful session, sir. Thank you for that. Hemchand, please come in.
Yes, sir. Good evening to one and all present here. It is the great honor to propose the vote of thanks on this memorable occasion. Let me first of all start by thanking the Almighty for blessing us abundantly and making today's occasion a resounding success. First and foremost, I thank our speaker, Dr. Vijay Shankar, SD, for spending his valuable time on today's session on prevention of dry eyes and eye-related issues. We are extremely grateful to our beloved director, Dr. A.G.V. Narayanan, for his words of encouragement. I also extend my heartfelt thanks to Captain Senthil Kumar and the faculty coordinators for their valuable contribution and guidance in all our efforts. Last but not the least, I thank my seniors, friends, and participants from other institutions for your cooperation in making this program a resounding success. Thank you.
Thank you, doctor. Thank you, Ms. Sheila.
Thank you, sir.
Nice of you, ma'am.
Thank you.